Hi everyone who are watching Facebook Live and right here at the One Utama Shopping Center. Hello everyone. So my name is Jean. Alright, I'm the MC of today. Once again, welcome to the 360 Advanced Primary Eye Care Facebook Live brought to you by Focus Point. Alright, so today on this session, alright, we are talking about the importance of slit lamp assessment in eye examination. Because as per our previous live, the Dr. Fu has been saying that the awareness of protect your eyes among the public is quite low. That's why we want to deliver a correct information to you on how to protect your eye. That's why we have this Facebook Live. Alright, so ladies and gentlemen, don't forget, alright, to come here to the One Utama Shopping Center, ground floor center court, to join us for the Focus Point event started from 27th of April all the way until 7th of May 2023 until 10 p.m. because we'll be having varieties of tests for you to know about the condition of your eye. And throughout the period, we are having this Facebook Live as of what you are watching now. So don't forget to give us a like and comment if you do have any question, because we will be asking our professional later on behalf of you. And don't forget to share the Facebook Live as well. So, and as per mentioned, we are talking about the importance of slit lamp assessment in eye examination. And today we have invited a professional to talk about this to you. All right. So now we would like to invite and welcome Dr. Mizhanim Mohamad Shahimin, the head of Optometry and Vision Sciences Program, Faculty of Health Sciences of UKM. Hello, doctor. Say hello to the Facebook viewers and also the attendees right here.
Hello, everyone. Good afternoon. Ecstatic to be here.
Yeah. All right, doctor. So, kindly introduce yourself. What is your background there to the Facebook viewers?
Right. Okay. I'm Dr. Mizhanim from University Kebangsaan Malaysia. I'm senior lecturer in University Kebangsaan Malaysia for almost 20 years now.
Wow, kind of very rare experience.
Very long time.
So yeah, that's the guest we are inviting, because this is very experienced to deliver the right message to the public on how to protect their eye. So today, doctor will be talking about the slit lamp assessment. But in a layman term like me, a public like me, I don't know a slit lamp examination. So what's slit lamp examination? Can you
All right, okay. So slit lamp examination or slit lamp biomicroscopy is simply checking the eyes, okay, using an instrument which is called slit lamp.
All right. So through the examination, what can we actually examine?
All right, okay. So just generic ocular structure, not just at the anterior part, but to the far behind the retina.
I see. So yes. I think doctor will have a more in-depth info through the slide. All right, so doctor.
All right, okay. You. Yes, thank you so much, Ed. All right, so I hopefully can shine a bit of light of eye care assessment and talk about slit lamp eye examination for everyone and why we should incorporate this in routine eye examination. All right, so before I move further, I would like to disclose I don't have any financial interest to the products that I'm going to talk about today. Yeah?
Okay.
All right, okay, so this is the outline of my talk and sharing today. I'm going to give some overview of the slit lamp so that everyone know what a slit lamp is. And then moving further to the benefits of incorporating this assessment to the routine eye examination before ending and summarizing on the challenges and opportunities for us, yeah? All right, so let's have a look at the overview of the slit lamp. Okay, so if you look at this far right instrument, it's a bit intimidating, right? So this is the slit lamp, yeah? So slit lamp is actually an examination, the technique to assess eye ocular structure. So it's non-invasive technique. It's not harmful, although it looks intimidating, all right? But it's just basically an instrument only to check the eyes.
All right.
All right, okay, so let's moving on and have a look at what is slit lamp. So slit lamp has two types and it encompasses three systems. So basically what we have here is the observation system, okay? Essentially, it's just a microscope combining two microscopes together.
Okay.
And usually microscope is to magnify view. All right, so this is what the observation gives us.
Okay.
So we can have a look at up to 50 times magnification. So that means cellular level of the eye, yeah? And then we have this illumination system. It's actually a tower encompassing lighting, Okay, and we have array of filters there that can change the white light to different lighting, so where we can manipulate that and have a look at the eye comprehensively.
But actually, what is the difference between the two systems?
All right, okay, the observation system is for the examiner to look at the eye.
Okay.
The illumination is just to illuminate the ocular structure so we can see it clearly.
So if, for example, I want to go and undergo this task, so I just do either one or both undergo
Oh
together?
no, it's one system.
Oh, one system.
Yeah,
All
one
right.
system.
All
So
right.
we have another mechanical system,
Okay.
which is actually to move about all these two systems together.
Okay.
All right, and we for those who don't know what slit lamp examination is, so this is what you should expect from the slit lamp examination. Yeah, so we have here a picture whereby the patient is actually seated securely because we don't want the eyes and head to move. Okay, during the examination.
Okay.
So you should expect that you have to fixate and have the headrest and chin rest securely to the table here, and then you should expect to maybe the examination will involve dyes and also drops.
Oh, okay.
So we will use usually fluorescein staining, which is yellowish, that can highlight the problematic area on the eyes. And sometimes when we feel that it's necessary, we will use dilating and also anesthetic drops. Okay? And because just now we mentioned about the illumination system, so you should expect that it will be bright light shine through your eyes.
Okay.
But if you have any trouble or not comfortable, you can always tell your ECPs, eye care practitioners, so they can adjust that for you.
Okay. Oh,
Alright.
so the light can be adjusted.
Yes, can be
I see.
adjusted. Not too bright, don't worry.
Okay.
All right, and then you should be expected to follow instruction of the ECP so that the examination will be smooth. All right. Okay, so then we need to have a look at the benefits of incorporating slit lamp, yeah? Rather than just looking at maybe checking the eyes, the power, okay? So this is the regular eye that we can see from the naked eye, right? But with slit lamp, it can be enlarged until we can see the fundus here. This is at the back of our eye.
Okay.
So the whole structure, the ocular structure, we can view through slit lamp. But of course with attachments or auxiliary lenses, yeah? All right, okay, so slit lamp as it is just looking from the cornea, the outermost part of our eyes, right until the crystalline lens, our lens, okay? But if we use other attachment, like tonometer here, we can measure the intraocular pressure
I
just
see.
now, all right?
Like
And
what we talked about in the
yes,
first session,
correct,
right?
okay? So we can use this attachment to also measure intraocular pressure. The Vogue lens here to view right until at the back of the eye. And also if we have imaging system, it will be very good to keep track of the ocular structure because we can save all the images for later view. All right? Okay, so why we should incorporate this? Okay, because we need to improve the treatment of the optometric to the public, yeah, and also to help detect eye diseases. Because sometimes those who are having problem with the eyes doesn't realize that they have that problem. Not until the ECPs find out, yeah, from the eye examination. All right. So that's actually more than meets the eye. By looking at the eye, you can actually look at the whole systemic wellness. Yeah, so this is actually the conjunctiva, our outermost part, the white part of our eyes. So if it's turning red, you know that maybe that person is having some allergies or reaction. If the whitish eye is actually like yellowish bit, so you know that there's damages in the liver. All right, so we can maybe further refer them to eye doctor or physician. All right, and if they having like redness with gritty sensation, so maybe they are having dry eye, and if their color vision changes, that could maybe tell us that patient having cataract. So that sort of things.
Okay.
Yeah? All right, okay, so monitoring is very essential, I guess, because our eye changes as we age, all right? So if we have that slit lamp examination as routine and the ECP is helping to following up all the wellness of the eye, it will be great. And this is another arm of optometric field, which is the contact lens fitting. And it's essential that we use slit lamp together with this contact lens fitting to assess.
So if we go for the contact lens fitting without undergo this slit lamp
Slit lamp.
examination, what is the consequences?
All right, okay. Because contact lens there's no one size fits all.
Yeah.
All right, okay. So therefore, we need to ensure that each contact lens fits well to the patient's eye. I have a few videos
Okay.
and pictures afterwards to see whether you really need to,
Yeah.
to have the slit lamp eye assessment. Okay. So we have array of different types of contact lens actually in the market. So public maybe know about the soft contact lens, the silicone hydrogel, but we also have gas permeable contact lens, which is a rigid one. It's quite small, okay, and a combination of these two material, which is what we call as hybrid contact lenses.
So meaning that through the slit lamp examination, we can know which contact lens is suitable for
Yes, yes.
certain people.
They have different function and usage. So with the help of ECPs, they can advise you what contact lens that's suitable for you.
All right.
Yeah? All right, okay. So we have here actually a video. I hope it can place very well. All right, okay. So what is trying to look at here is the fitting. All right, so the contact lens needs to move as your eye moves, because otherwise this is what you're going to end up with. Okay, you can see the line, circular line at the green line at the conjunctiva. So that is actually showing that the contact lens compressing your conjunctiva. So that contact lens is steep fitting. So if the ECP detect this, they will advise you for a flatter fitting for your health. Yeah, all right, okay. So this is the soft contact lens fitting. It's quite different for rigid contact lens because it's quite small, as you can see. Yeah, so we usually will check this fitting with fluorescein and to make sure that it's movable enough but still covering your pupil so that you can see very well. Okay, so that's essential in the fitting part. Okay. In terms of disease, okay, so this is not just limited to what I've shown in the slide, okay, but this is quite problematic and quite concerning, so quite common as well in our public, okay. So let's have a look one by one, okay. Because of the lifestyle nowadays, the digital devices, it's a bit like your extended arm nowadays, so we got lots of complaints of dry eyes. Okay, why? Because instead of you looking at the printed material, now it's digital and prolonged time, non-stop, no breaks, okay? Sometimes you feel that your eyes a bit gritty, your eyes turning red, so that is the sign of dry eyes. So with the slit lamp, we can view that the eyes actually turning red and we can grade them, whether that's severe or just mild. And with the fluorescent staining, we can see a compromised cornea over there. So the fluorescent will highlight all the problematic cells. So that will tell us that, oh, this patient is having dry eye, we need to give something to help, okay? And if there's any damage or injury to the cornea, we can view through slit lamp as well. The cornea should be transparent. It should be clear. But now on the right side, we can see a bit hazy over there. All right, okay. So that's some changes there that we need to capture and also refer to the ophthalmologist. All right?
I see.
Okay, so this is the bit that I mentioned about to the cellular level. Okay, so this is actually endothelium, the posterior part of the cornea, okay? Don't know whether you understand that. All right, but this is the cellular level in which we use 50 times magnification to have a look at them. So here is a very intact, healthy cornea cells. So the right side is the abnormal cornea cells in which you can see like a blobs of black areas. Yeah. So that is actually cell loss. So we know that the cornea has been compromised. So by looking at this slit lamp with a magnification of 50 times. All right, so cataract is quite common. And you should expect them as you age because unfortunately we're living at the equator area, UV light all over, all right? But we should know that we can minimize this problem with spectacles that have UV protection to avoid UV light, okay, to wear visors and all, okay? But if we see any cataract, because it will induce blurriness to our vision, so we need the ECPs to diagnose that for you. So usually these are the different view that we can see and detecting the cataract of different types. All right, so cataract usually we name after the location that we find the cloudy bed. All right, so this is some of the different views using slit lamp and detecting using the slit lamp biomicroscope. The ones that you've been talking about earlier
Glaucoma.
at 1 o'clock, okay? That is about the intraocular pressure,
Yeah,
right?
yeah.
Okay. So with slit lamp, and we use the Goldman tonometer, so we can also measure the intraocular pressure. Why glaucoma is so worrying? Because it can damage the optic nerve and it's irreversible. So once it's damaged, gone, blindness. Okay, so we want to avoid that. So we need to detect earlier. So last but not least is the retinal detachment. Okay, usually this is quite common for those who are having high myopia. Because of the eyeball elongation, the retina cannot really retain the shape, so it's going to detract and detach from the. So we need to really detect this earlier to avoid blindness as well. So let's have a look at the challenges and opportunities in implementing this slit lamp examination. Obviously, it will give a holistic, comprehensive eye assessment to the patient. Okay, if we can detect eye diseases, sometimes it also relates to the systemic disease. So we can also monitor that for our patient. If our patient is on a progression disease or in response of treatment, so slit lamp monitoring is also essential. And because slit lamp can be also attached with the imaging system, we can help in patient education for our patient. All right, so the challenges, because of that intimidating instrument, okay, it needs highly trained and skillful ECPs, all right? So fortunately, our education system, once you graduated optometry, you are sufficient enough to handle slit lamp. So you are in the good hands, okay? So slit lamp eye examination is a breeze, hopefully, yeah? But the slit lamp is also costly. And to maintain it also needs some money, of course, yeah. So that will be something that need to be incurred by the ECPs and also practice owner. And of course, it will increase chair time. Rather than you just have your eyes checked for your blur vision, 15, 20 minutes, you have to add another 30 minutes, yeah, for eye health check. But I think the benefits way more, yeah, than the time that you spend, okay. So I guess that's a good investment. So diagnosis, whether it's good or bad, yeah, it's not the end, okay? It's the beginning of practice. It's a way of actually monitoring the progression of anything that you have. So usually you should look at the bright side of this diagnosis, yeah? So I guess that's it.
All right, thank you so much, doctor, for the great sharing.
No problem.
But because still the slit lamp still very new for the public, like inclusive myself. So before that, I will ask you, because just now doctors talk about the slit lamp, like it's really good to do the eye test.
Yes.
But then in Malaysia, the technology of slit lamp, is there any difference between Malaysia and, like, for example, UK or India? There's a very technology advanced one.
All right, okay. So the instrument, the machine is actually quite standard. Okay, it's just that if you have added attachment, you have the Goldman, so you can provide extra care for your public, yeah, your customers and your patient. Otherwise, it will just be a standard instrument to check the ocular structure.
So meaning that in Malaysia, not much optical shop, they are providing this slit lamp examination, am I right?
I presume, yeah, perhaps, yes. But the awareness is, is better nowadays.
I see. Okay. There's one netizen asking, can doctor tell that what does the slit lamp examination do? Because he or she might misses the slide that just now presented by doctor.
Okay. So because the machine, we can change the magnification. So it allows us to view the ocular structure in detail. So perhaps sometimes we, with the naked eye, we cannot really see anything that changes. Okay. With the slit lamp, it can magnify the ocular structure. We can go deeper. We can utilize all the fluorescent dyes and all. So we can, capture the whole bit of the eye health and wellness, yeah.
Other than the, like, for example, cataract, glaucoma can be detected through this slit lamp examination, any other disease related to eye then can be detected through slit lamp examination?
Yes, anything that can compromise the ocular structure, everything can be detected by the slit lamp.
All right, so there's one asking from Facebook, asking what is a slit lamp? This is a very netizen question.
All right, okay. So slit lamp is actually an instrument to check the ocular health. It's actually using a beam Yeah, it calls slit because we can change the white beam to slit and change and manipulate that to enhance our view. So hence the name slit lamp. Yeah.
I see. So just like doctor is talking about the undergraduates in optometry courses,
Yes.
they should be able to handle the slit lamp well.
Yes.
So normally in the like in the undergrads or degree, how do they learn how to control the slit lamp?
All right.
Is that need like for example, I'm the netizen. All right, I undergo the training. Can I control the slit lamp well?
Oh, all right. Okay. You need some training, obviously, because you need to know the optics of the instrument. So usually our student will learn about the theory part first, and then they have laboratory, series of labs and checking their friends' eyes before checking the real eye of patients. So series of training, obviously. Yeah.
So normally how long they need to learn or undergo the training to be able to handle the slit lamp examination well?
All right, okay. So we teach over the course of 3 semesters before they can actually use for the clinical year, their final year, 4th year.
I see. Okay. So this one asking, why is it important to do slit lamp examination test?
All right, okay. It's important because it's different than just examining the power of the eye. All right, we are actually looking at the ocular structure, and sometimes those who are having problem doesn't realize that they have that problem. So we need someone to look at the eye health, detect, and sometimes that can save life as well and avoid you from blindness. Okay.
Just doctor talking about that through the slit lamp examination, we can actually detect the eye pressure.
All right, yes.
So how does it gonna be detected?
All right, okay, because we use this attachment which is called Goldman tonometer probe, okay. So this probe, it's quite invasive if we measure IOP using slit lamp. So it's going to put a slight pressure to the eyeball, and then we have a scale to detect the ocular pressure. So that's how we measure the intraocular pressure using slit lamp.
I see. All right. So just doctor talking about the because the contact lens fitting is related to the slit lamp examination.
Yes.
So how does it gonna determine what kind of contact lenses is specific to suitable for specific category of people?
All right, okay. So we look at different aspects of contact lens fitting. So usually, commonly it's about centration, the movement, okay, and whether the patient can see a clear, crisp vision with the contact lenses on. So basically, the patient will come in and tell us what they want. If it's for therapeutic use, meaning if they have like condition like keratoconus, which we must help in therapeutically. So there are different contact lens for them, okay. So but your regular use for just correcting the eye refraction is soft contact lens or RGP. So we need to have a look at the fitting because I said just now, there's no one size fits all.
I see. All right. So how often should we check the slit lamp?
I would recommend annually. But usually if you have any abnormalities, your ECP sometimes want to see you earlier, about 3 months maybe once. Yeah.
All right. So if you want to do this slit lamp examination, the cost will be high?
Okay, I cannot say that for the private practices, but in the university it's free of charge, okay? But it will entail a longer period of time because you have to spend a longer chair time in the clinic.
All right. So can I say that because if you want to take care of our eye we need to monitor our condition of the eye very closely. We need to do 3 months once for the slit lamp examination,
yes,
right? All right. So last but not least, we want to ask, why is slit lamp examination important to contact lens wearer?
All right, okay. It's actually to ensure that the eye health is not being compromised by wearing contact lens, and sometimes because we want to avoid sleeping with contact lens. If you're not meant to, or a bit of overwear, so we need someone to monitor that for you.
So if doctor would like to recommend a category of people to undergo this slit lamp examination, so what is the regular category that should to
Okay.
undergo that examination?
All right. I would recommend everyone to have slit lamp eye
Inclusive
examination.
of a child?
Yes, yes, at least once, so that we have a baseline of your ocular eye health. And then as you progress, if you have any problem, then you can repeat that. So usually it's annually. But we also do slit lamp examination for the kids as well, if there's any indication, yes.
So in terms of increase the awareness of doing this slit lamp examination,
Alright.
so what is the awareness or what is the event that government has been done?
All right, okay. So this should be embedded in the routine eye care examination, and maybe because the awareness is a bit lacking of whether you need to have your eye exam, including the slit lamp assessment. So now, I guess, I will encourage everyone to request, okay, slit lamp examination every time you come into the, eye examination test. Yeah.
Actually, the eye examination is very, very important to
Okay.
the public because we need to know what is the condition of our eye. So,
Yes.
how can we rescue our
Okay.
eyes before it's too late? So, people can actually come here to the Focus Point event until before 7th of May 2023 to get your eye check right here. So, last but not least, doctor, can you please urge the public to take care of their eye? Or any words to the public?
All right, okay. A simple wisdom and slogan, I guess, yeah? If you're wearing contact lens, or maybe if you're not, okay, make sure that your eye is well, okay? You see well, you feel well, okay? You look well, okay? So all these three well, okay, then you are actually in the right path of maintaining your eye health.
I have one question for doctor. In the professional terms, point of view, how to actually take care of our eye?
All right, okay. So just now we did mention about the dryness and digital lifestyle. Okay, so don't forget to blink. Maybe it's something that, but it's very important because you need to replenish the tears in front of the eye. All right, so drink well, eat well, and have a break every 20 minutes if you are in a prolonged digital use. Yeah.
What kind of food should we eat in order to protect our eye other than carrots?
All right, okay. Carrots cannot be taken extensively.
Oh, okay.
Okay, so everything is moderation. All colors of vegetable, the greens, carrots and everything. All right, but I think everything should be taken in moderation, so that you can maintain the eye health. Okay.
All right, so eye health is very important, and we would like to extend our warm gratitude to Dr. Mizhanim Mohamad Shahimin, the head
Thank
of
you.
head of Optometry and Vision Sciences Program, Faculty of Health Sciences of UKM.
Thank
So once,
you.
ladies and gentlemen, if you want to know more about, you want to do the eye check, you want to know more about the condition of your eye, do come here to the Focus Point event. Started from 27th of April all the way until 7th of May 2023, right here at the One Utama Shopping Center ground floor, all right, at the center court. So you should be able, and all of the task is actually FOC, free of charge, so that you can actually come and have a look, walk and see, 就是来走走看看一下 to know what is the condition of your eye. Alright, do stay tuned to our Facebook page because we will be doing such an educational posting and also some Facebook Live for you to know more about how to taking good care of your eye. And don't forget to give us a like and comment. And also don't forget to share to your friends so that all this very useful information from our professionals can be delivered and spread the good information to all the public. All right. So once again, thank you so much for your view, and thank you so much to all the attendees for having us. All right, to view this Facebook Live. We hope to see you in the future, and don't forget to keep an eye on our Facebook page. Brought to you by Focus Point. Thank you.